beyond even COVID long haul, you talk about things like Lyme, which is a very big one for cell memory after you battle Lyme, borreliosis. You can have these reoccurrences. So are you
Yes,
seeing the similar type of impact as you saw on the long haulers in Lyme disease patients with TrueDose?
absolutely. I mean,
Yep.
I can't believe how many Lyme people we're treating today. It's almost like there's such a non-awareness of how much Lyme there actually is. And what this treatment does for Lyme patients, they will, they need to be on that 8 to 12 week regimen. And what happens to them is that, the first treatment, they'll feel great. They'll feel better than they have in years. They'll go to sleep. And that's all these effects, all these benefits are basically, it's a lot of clearance out of all the Lyme pathogen, right? The parasites and all the co-infections, the EBVs, all these things that are stacked on top of it. But it's basically clearing out kind of like the first wave of the infection. And usually the second treatment with Lyme is, they'll see kind of like this ebb and flow of like, I feel good, I feel bad, I feel good, I feel bad. And at about, sometimes it lasts a week, but it's a lot of herxing and a lot of detoxing. And what we found of what's really happening, you're getting that Lyme that has really rooted itself into your joints and your tissues. It's the one that's impossible to be found. So once you do the first treatment, you clear out the first wave. Those are kind of like the ants on the anthill, which you can visibly see. The second treatment is getting down it's like taking a shovel and digging it down into the dirt, and you're getting down to the real problem. By the third treatment, these patients are, and we've measured this in the blood. They're all these viruses and co-infections are not only, at a level to where they're not activated, they're not even serologically in the blood. They're not there anymore. They're feeling better, not only feeling better symptom wise, but they're also reversing as far as metabolically in the blood, their age of their blood. Their brain cognitively is literally being turned back on. We've even collected symptom scores from a few of our clinics that are doing these routinely, every 4 weeks, every 2 months, every 3 months. And these are, medical symptom questionnaires. You measure, gut, it measures a whole number of things and gives you the cumulative score at the end of it, right? Patients, this is routinely. I don't have the numbers in front of me, but the symptom questionnaires are, I would say 60 to 70% drop after the first, 2 weeks, as far as scores in the hundreds. Now they're in the 40s. And it keeps progressing on. More importantly, what we're seeing is that, again, all the blood data that we're showing, which I want to get back into, that people are getting off of these 50, 60 supplements a day, that they have to take. And they're reducing, from 50, this is not a lie, 50 supplements down to 10, 24 supplements down to 3. And this is after usually the first treatment.
Why do you think that is?
Well, the body's working again.
Yeah.
And we tell people this, that if you're coming from conventional medicine, let's take Lyme. If you're coming from conventional medicine, you're used to doing antibiotics and non-integrative treatments, then this therapy, the TrueDose therapy, is literally going to put the gas pedal on the floorboard and make your body work like it's never worked before. And so you're going to experience a polar shift of detoxing and all these things, at the organ and cell level, working for the first time again. And what that looks like to you is going to be a lot of like, oh man, this is bad, because you're experiencing such a polar shift.
Yeah.
To someone who's been in integrated medicine, it'll feel more like, man, I haven't felt this great in a long time. Now, the person who's been in conventional medicine, they'll eventually get there, but that's where they start doing, the IV nutrition, the light therapy, the detoxing, and it's part of the protocol. But they get off. I mean, if you think about it, those supplements are needed because obviously the body's deficient in a certain area. So if the therapy is exiting the body out of these feedback loops, whether it's MTHR, whether it's vitamin C deficiency, whether it's I'm not detoxing correctly, then I don't need to take the supplement, whether it's liver support, that I don't need to take the supplement that's needed to augment that. And so it's like, I don't need it. I don't need the antidepressants. I don't need the lithiums. And patients are literally, on one hand, doctors are testing for these things and saying, you don't need this anymore. On the other hand, patients are also saying, you know what? I don't need that anymore because I got it tested. I wonder if I can get off this antidepressant. I wonder if I can get off these depression medications or these pain medications. And they literally start weaning themselves off.
Now, a lot of patients that go through Lyme, of course, are placed on antibiotics, which have a negative reaction within the body, can cause a lot of die-off, can cause a high level of toxicity within the body. How does that account within TrueDose? And that goes for many different conditions where you have antibiotics, you have a die-off, you have a higher level of toxicity within the body. And then you do something like this that actually optimizes the body. You mentioned Herx before. You go too fast, you have a real detox where a patient's like, I'm out. That was bad. That was a terrible, even though it's flushing the body. How do you account for that so many people are going to be on antibiotics, then possibly do TrueDose therapy and have a Herx reaction? Is there something you're looking at to minimize that?
Yeah, this is almost like a disclaimer. I'm not a doctor. I'm really reporting, but kind of like what patients are told to do is listen, I know this is going to really sound crazy, but you need to stop taking what you're taking right now. And you need to let the therapy do what it's going to do. And that's a hard thing for patients to do because they've taken that antibiotic, that depressant medication, that pain medication for so long that what we learned is it's literally a crutch.
Yes.
And psychologically it is hard. But I can tell you that if you stop taking them, a couple of days prior, a week, sometimes a week prior, and you get to the point to where you're like, okay, this treatment better do what it's supposed to do because I'm starting to feel bad. The treatment literally fixes what that medication was providing. And so it fixes it and now you no longer need it. And it doesn't happen often where patients say they can't take it and they just go back and start. But what does happen when patients do get the TrueDose treatment and they continue to take the antibiotics, they end up herxing even worse. Because it's just like the TrueDose therapy is already doing that work that medication was trying to do. And then you add the medication on top of it and it's like, well, that's too much.
Yeah.
And so we get these calls and we get these questions and the response is, well, ask them if they're taking the medication again. And the answer is yes. And it's like, well, you got to tell them to stop. And then boom, the problem they were having goes away.
Yeah. What we're witnessing actually at our clinic is a similar thing where we usually try to wean people off as much as possible. Most of the people are already off antibiotics that by the time they got here because they realized it wasn't working for them. But it's always a level of gentle oral detoxification before you go into IV, before you do the PRP and everything else like that. Just get the body in a better situation to accept the PRP and the corrective measures that sometimes will push so many of the toxins out and cause an unwanted. But again, in Europe, they look for those reactions. They want to push that out and have you having a headache and fatigue because they know that is a good thing for getting rid of things and sets you on the right path.